Hello friends, welcome to the Masapharm podcast. Here in this space we share health, we share information that will help you live a better life. And in this episode we are going to share about a very interesting, at the same time confusing to many people, a topic that brings a lot of questions, that is family planning. And I'm Jim, your host. I'm joined by our pharmacist here at Masapharm Pharmacy. I'm going to give him an opportunity to introduce himself, and then we shall proceed into today's topic. You're welcome.
Thank you, Jim. And I must say that I'm thrilled to be here on the Masapharm podcast. Yes, so my name is Joseph Makawa, a pharmacist. I work with Masapharm Pharmacy. It's located here in Kawaala. And today's topic is really important. And I hope that by the end of our discussion, you would appreciate what family planning is, and also be able to know, am I supposed to use it or not? So we hope that by the end of this discussion, you'll pick one or two things.
Sure, indeed. Doctor, we shall start right away. Family planning, what is it? What is it? What is family planning?
Yeah, so family planning is a common thing. In fact, as a lady, I'm sure in the due course of your life, you'll interact with it. So family planning, it has many words. There are those that call it family planning, others that call it contraceptive, reproductive health. But literally, these are methods that we use either to prevent getting pregnant, unwanted pregnancies. So family planning, literally, it involves let me go back on that. So family planning is a common topic, and there are several words that we use to mean the same thing. The likes of reproductive health, the likes of contraceptive, but these are all methods that we use to either prevent one from getting pregnant, or we can use them when it comes to child spacing. And most of us came to learn about it in the early 1960s, because this is when family planning became really common in the 1960s. Not an old thing, but indeed it is important, because with family planning you can then be able to plan for your children, you can be able to prevent getting pregnant when you do not wish to. So in the due course we shall appreciate the different forms, who is eligible, and that kind of stuff. So something like that.
Okay. Doctor, I'll get from where you mentioned something, planning, planning for the family. I want you to clear something out of our viewers' mind. Some people are actually terrified of family planning. In our African setting, some people believe or think and question, are we stopping life? What do you have to say?
So it's actually a common myth or narrative out there. In fact, I think a few hours back, I was flipping through TikTok, and then I came across a certain lady saying, I'm not a mother, I'm not planning to become a mother, but one thing I'm sure of is that you should never use family planning. I'm sure she's actually basing on the misconceptions. Listen to this. Family planning, we call it the modern methods of family planning, are safe. They are safe, and we shall appreciate how to use them. We shall appreciate their side effects, and then we shall also be able to know that we actually need them. So when you speak of family planning, it's because of these methods that we can be able to determine when to get pregnant. It's important because some of us may be in school and we need to focus. Some of us may have just gotten a new job. We need to focus. So you may need to plan when to get pregnant, and that's where family planning comes into play. Something to note, it has to go hand in hand with your partner. So when I say family plan, doesn't mean that you exclude either the male partner. No, you have to discuss it with your partner such that you both agree on when to have such a pregnancy. So we shall appreciate the different methods and how to go about all that.
Okay, that's wonderful. So I know there are so many family planning out there, but one question for sure is that most people don't know. Don't know about them. They could have information, this, but I want you to paint a picture for someone who is just hearing about family planning for the first time. You tell us the different methods under there and who they are suitable for, and if there are any effects or side effects someone should be aware of. Would also want to know that.
Yeah.
Yes.
Thank you, Jim. Maybe before I dive deep into that, let's appreciate family planning. There are those of us that fear using it. Why? We believe that it causes infertility. The modern methods of family planning do not cause infertility. What do I mean when I say you are infertile? So, when you say that someone is infertile, it means that in the past 1 year, they have been having unprotected sex and they have failed to get pregnant. Yes, so, and let me say this, it affects both males and females, though ladies usually take most of the blame, but it also affects the males. Now, in the due course of our lifetime as ladies, we may need these family planning methods. In fact, we say that 1.9 billion of the population around the world is the ladies. 1.9 billion of the reproductive age. When I say reproductive age, these are ladies between the ages of 15 to 49 years. It means in such an age, you are viable to carrying a baby, to getting pregnant. Yeah? And if you are sexually active, then you can actually get pregnant. And about 1.1 billion of such people, the ladies, do not have this access whenever they need. So there is this gap. It is our duty, those of us in health, to bridge this gap. Now, most of us do not actually use this family planning because we are not taught, we are not guided. But hey, family planning is actually good. You need to be guided on how to use it. Why do you need family planning? One, like as I'd said in the introduction, we use it, one, in planning on when to have children. Two, it enables us to really prepare for our lives such that we are able to improve on our quality of life. When I say that, I mean that there are some of us who, when we get pregnant, it affects our performance either in school or at work. But if you are introduced to these methods and you're sexually active, you can then focus on your work to improve on your quality of life as you plan on when to have such children. In fact, I'm sure that those of you who are in school, the ladies, before you report back to school, they first test for the pregnancy. When you're pregnant, you do not actually enroll to progress with the term. So, having said of that, there are different methods of family planning. Some of them will be categorized into either hormonal or non-hormonal. Others will be called permanent or maybe not permanent. But the commonest is hormonal and non-hormonal. When I say hormonal, it means that we are using synthetic hormones to try and prevent someone getting pregnant. And there are mainly two hormones. We have the estrogen hormone, we also have the progesterone hormone. The commonest being progesterone. The non-hormonal methods, these are extremely safe. So those of you who fear here family planning, have you also known the non-hormonal methods? Because for them, they do not have any side effects. Why? They do not have the hormones in them. So out there, you can either choose the hormonal or non-hormonal. But as I will unpack these methods, you'll appreciate that there are those that are preferred in child spacing. There are those that are preferred if some of you are planning to get pregnant, maybe after a short period of time, that's when you plan to get pregnant. So meaning that you want to become fertile within maybe 3 months, maybe 1 month, or that kind of stuff. Whereas the non-hormonal, they are preferred, maybe you find the hormonal ones really uncomfortable. Yeah, so can I progress to the hormonal? So when you speak of the hormonal methods, how do they work? I've said there are 2 hormones. We have the progesterone or progestins. We also have the estrogen. So the hormone progesterone has effects on our body. When you take the hormonal methods of this family planning, the progesterone in them, one, it will delay ovulation. It does that by suppressing what we call the LH surge. Maybe just a step back. These hormonal methods work by affecting what we call the hypothalamus, pituitary, ovarian axis. There is an axis. There is that connection. The hypothalamus, the pituitary gland, and then the ovary. There is that linkage. And that linkage is affected, or rather regulated, by hormones. And progesterone plays a critical role in regulating that axis. And what it does specifically is it suppresses what we call the luteinizing hormone surge. Now, luteinizing hormone is responsible for ovulation. When I say ovulation, this is when the egg is being released from the ovary. The ovum is being released from the ovary. Now, first, it suppresses what we call the LH surge. There's that sudden increase in that hormone before ovulation takes. So it suppresses that. When that happens, ovulation does not take place. That's one. Two, the progesterone in these hormonal family planning methods also increases the thickening of the cervical mucus. When it does that, then it prevents the movement of the sperm to swim to go and reach the egg. Another way it does that, progesterone, is that it causes what we call atrophy of the endometrium. Remember, for someone to have a sustained pregnancy, the endometrium, or the inside lining of the uterus, must be well nourished. So what progesterone does is that it causes that atrophy, so that it does not prepare the inside of the womb to receive the baby. So that is one hormone. We also have the estrogen. The issue of estrogen, what it does, one, is that it suppresses what you call the follicle stimulating hormone. It inhibits the action of the follicle stimulating hormone. In so doing, it prevents the maturation of the dominant follicle. So these hormones are combined with the reason. Something to note, majority of the contraception is because of the progesterone. The estrogen is added because it has other benefits. One of them is that it tries to mitigate on the side effects of progesterone. Now, the commonest of the side effects of is that it causes irregular bleeding. So they add that progesterone to suppress or to mitigate or to counter such a side effect. However, you can also have family planning methods that are hormonal that contain only progesterone. Having said that, now let's come to the methods. We have what we call combined hormonal contraceptive methods. We also have what we call progesterone only methods. Under the combined hormonal contraceptive methods, there are different subcategories. That's why we have what we call the pills. Yeah. We have what we call the transdermal patches. We also have what we call the vaginal rings. 3. The commonest being the pills. Now let me come to the pills. So we have the combined oral contraceptive pills. Most of us have seen them. In fact, if you have to go to the pharmacies, you have to go to the hospital, you have to go to medical centers or clinics, they are there. Here in Uganda, we have the brands of either Pill Plan, which was later not approved. Okay, we have the family planning pills, the oral contraceptive pills, commonly known as COCs. Here in Uganda, we have different brands, the likes of Wellplan, the likes of Lydia, the likes of Microgynon, FE, and others. Now, these pills contain both progesterone and estrogen. Something to note about these pills, you are supposed to take them regularly, preferably at the same time. So if you have chosen, say, after supper, then you have to maintain taking them after supper. Why? When you miss these pills, they may have some consequences. And let me highlight this. You're supposed to take these pills at the same time. But in case you miss one pill, then you're supposed to take them as soonest as you remember. There are instances when you have forgotten, maybe more than 2 days. So when you forget taking them after 2 days, then for you to be able to be protected against pregnancy, you have to take it as soonest as possible, but then you have to add on what you call a backup plan. In this case, you have to take, you have to go with the condom. So we have the pills. We usually prefer pills in instances when you want to return to fertility as soon as possible. Usually, these pills come as in form of cycles, so they are like, they are those that have 28 tablets, of which the 21 contain the hormone, and then the other 7, these are just placebo. Placebo is something that will not contain the drug, but supposed to give the impression that contains the drug. I'll talk more about this. So we have talked about the pills. We also have what we call the transdermal patches. These are small, square, clear patches about 2 inches across that you put on the body. They also contain this hormone that you put on the body. You can either put on the stomach, you can either put on the upper arm, you can either put on the buttocks, you can either put on the back. So they keep releasing this hormone slowly over time. So the patches are supposed to be replaced every week. So when you put it maybe today, after 7 days, you're supposed to remove and then put another patch. You do this for 21 days, those are 3 weeks. The last week you do not put, so that you trigger what you call a withdrawal bleeding. I'll talk more about this. So the patches are not so common. In fact, patches started being used in 2014. They are really relatively newer, and they are not so common. Then we go to the third form of this hormonal, whereby we have what we call the vaginal rings. These are small circular rings, about 2 inches in diameter, that you insert in the vagina, and you leave it there for 21 days, those are 3 weeks, after which you can remove. Now, those are the what we call combined hormonal contraceptive method. There are 3: the pills, the patches, transdermal patches, and then also the vaginal rings. Now we come to what we call the progesterone only contraceptive methods. This is where we have what we call the injectables, we have what we call the implants, we also have we call the IUDs. So when you come to the injectables, most of us know it as Injectaplan. It contains medroxyprogesterone acetate. Commonly some of us call it Depo-Provera. Here in the Ugandan market, we have the Depo-Provera, we have the Lydia, we have and even others. So the injection is supposed to be given IM, intramuscularly. You can put it you're injecting into the deltoid muscle, and it's supposed to last a person up to 3 months. 3 months. Lately we have also started having those that you can give subcutaneously. For example, we have now on market the likes of Cyana. There are those that you can give subcutaneously. There are those that you give intramuscularly, but also there are those that you can give subcutaneously. Now these injectables, they come with their own side effects. The commonest being that usually people with these progesterone only pills, they tend to have what we call irregular bleeding. There are those that when they use these pills, they use these injectables, there are those that put on weight. In fact, I've seen ladies that say, whenever I use these injectables, I put on weight. It's a common side effect of these injectables. And then also, there are those that have challenges with spotting. There are those that never go into their P's. By the way, something to note, when you're on these hormonal contraceptive methods, especially the injector plan, you may not go into your P's. There are those that may go into them, but irregularly. These are common side effects. I think as we proceed later on, I'll talk about the pills, how ladies can use them either continuously or extendedly, not to bleed. I'll talk about it later on. So on the injectables, I've highlighted that we have the irregular bleeding. There are those that may not go into their P's. There are those that may actually have what we call irregular bleeding, which I mentioned. They may not go into it. And then there are those that may put on weight, or there are those that may have challenges with what we call diabetes. There are those that have challenges with blood sugar regulation. So let me go to the next one, and these are implants. So implants, these are small rods about the size of a matchstick that you insert under the skin, upper arm, that kind of thing. And they are supposed to last 3 years. There are those that come as a single rod, and then there are those that come as 2 rods. Those one last up to 5 years. Now implants are good, especially for those mothers who are planning child spacing. So usually after you're giving birth, you talk to your musao, and then they can organize to have an implant. So there are those that can last 5 years. There are those that can last 3. So if you're interested in having kids after every 3 years, you can choose to use the one of 3 years, which is 1 rod. If you're interested in having another baby after 5 years, you choose the one that has 2 rods. So I think at the end of this, I'm going to come back, and then we shall talk about the side effects, the contraindications, who is eligible, and that kind of stuff. Let me proceed to the next one. We have the IUDs. IUDs, intrauterine device. So these are others call them Y-shaped, others call them T-shaped. So these are devices that are inserted within the uterus, and they are supposed to prevent someone getting pregnant. So lately we also have those that contain the hormone, and these IUDs, they are good, they are effective. In fact, we usually say that the implants, the IUDs, these are long-acting reversible contraceptive methods. They are highly effective. Why? After using them, or after them being applied, there is no wastage of time to know when should I again take or monitor. The thing remains there and keeps preventing you from getting pregnant. So those are the hormonal ones, but we also have the non-hormonal. So under the non-hormonal family planning methods, we have those that are what we call behavioral methods. When I say behavioral, that's where we have the subcategory, the likes of withdrawal, the likes of fertility awareness based methods, where you look at the safe days. So we have the behavioral methods. We also have what we call the barrier methods. Under barrier, there are those that contain spermicides, there are those that do not contain spermicides. So under the barrier methods, we have what we call the condoms. So condoms are actually good, only that lately ladies do not like condoms. They prefer to have that, we call it live, meat to meat, flesh to flesh. Yeah, so condoms are good in that, one, they prevent you from getting pregnant, but then also at the same time, they help to prevent someone getting STIs, sexually transmitted infections, the likes of gonorrhea, the likes of syphilis, and others, even UTIs. But they also have benefits of preventing you from getting HIV. I'm sure there are those of us that react to some condoms. Those are latex condoms. Now, latex, if you are really reactive to latex, I understand. There are those which are latex free, however, they may not really prevent you from STIs. Yeah, so those are condoms. You also have what we call the diaphragms. Usually diaphragm, these are inserted in the vagina to cover the opening to the cervix, and usually they contain the spermicides. So spermicide, these are chemicals that kill the sperm. Yeah, so not so common, yeah, because usually spermicides also have their challenges. One of them is irritation. One of them is that they tend to increase the shedding of the HIV virus. So in case someone is having HIV and then they happen to use such spermicides, they increase the shedding of such a virus, in that if someone is not to have intercourse with you, you can easily spread that virus. So not so common. Yeah, so I wouldn't really recommend. It's my own bias. Now, we also have what we call the copper-bearing IUDs. These are also non-hormonal. Yeah, so the copper-bearing IUDs, after insertion, they release the copper ions. These copper ions are also spermicidal, so they kill the sperm. And these copper IUDs, they can last up to 10 years. Yeah, that's how effective they are. Yeah, so those are the barrier methods. And then you also have I spoke about the behavioral methods. One of them is withdrawal. Highly not effective, but of course there are those people who are really good at their thing, in that withdrawal is that when you're having intercourse with a lady, just before you ejaculate, you're supposed to pull out the penis and then you ejaculate outside. Yeah, so not highly effective. Why? Because some of the semen that comes before someone really ejaculates may contain some sperm. So there are those that have succeeded with it, but there are those that may have not really succeeded with it. Then you have what we call the fertility awareness based method. This is where we look at the fertile and the safe days. So usually a lady has what we call the fertility window and then the safe window. Yeah, so just to summarize it, take an example when a lady has a normal menstrual cycle of 28 days. We believe that on the 14th day of such a cycle, a lady is ovulating. Now, when do you know that your cycle has started? Your cycle starts on the first day that you start bleeding. That's when you count your first day of the cycle. So on the 14th day, that's when ovulation should take place. In most cases, when ovulation is taking place, there's increased libido, there's increase in the body temperature, yeah, that kind of stuff. And actually, I've had some ladies tell me that there are those that actually feel the movement of such an egg. They experience some sort of slight pain, yeah, in their abdomen. So So 14th day is ovulation, the most fertile day. Yeah. So usually from the 9th day up to the